Are you like most people? At times you may have a question for your doctor, but you can't get to him or her, so that you may ask your question. Good news. Your worries are over. Because the Mount Pilgrim Missionary Baptist Church, in partnership with Caldwell UNC Health Care, bring to you Let's Talk to the Doctor, a 15-minute talk with real doctors from the Caldwell UNC Health Care, designed to educate and answer questions that are a concern in our community. Let's not forget, our communities perish for the lack of knowledge.
Well, good day and welcome to another Straight Talk at Mount Pilgrim Missionary Baptist Church. And I'm so glad that we'll continue to have personnel, directors, doctors, all from UNC Caldwell Hospital here in Lenoir. And today I have with me Mr. Jarrell Suddreth, who is the manager and everything else from the clinical team, and also the overseer of our ICU. And Mr. Jerrell, you can add to that, and I'm sure I may have messed your titles up or I didn't say, but I would like to introduce to you this time Mr. Jarrell Suddreth, and just tell us a little bit about Jerrell.
Well, originally from Lenoir, North Carolina. Born and raised here, so it's a delight to be able to come back and speak with everybody regarding this matter. But my current role, like you corrected, is pretty much the director of the fourth floor. I manage the day-to-day ins and outs of the units. A jack of all trades, a master of none.
Yeah.
So I do a little bit of everything that the community needs, that my employees need, the patients needs, and I'm just here to serve.
Yeah.
So, a little bit of background on me is I graduated from West Caldwell High School, ventured down to Greensboro, finished up my college career down there in North Carolina A&T. From there, I actually came back to Lenoir for a little bit and worked in our current ICU as an ICU nurse. And then I ventured out to CMC, Charlotte, where I was working there in all the ICUs, floating around, learning different units from neuro to trauma to heart and vascular, got that experience, and then I worked my way up in leadership, obtained my master's degree, a master's in nursing and a master's in business, and then I decided to come back and help our community as much as possible. So I'm here today and on the front line, fighting this terrible, terrible virus that's tearing through our community, not only in Lenoir, but in the world right now. So that's what brings me here today.
Well, good. Well, I'm so glad that you're here, and I'm so glad that you come back to lend to the community where you grew up, just to give something back. And we're so proud to have young men such as yourself that will come back and do all the good things that you're doing. And you've been well traveled in the medical field, but I'm not going to break that a little bit, but saying that you are in the ICU department, Jerrell, how worried should we be about the unvaccinated?
From an unvaccinated perspective, I know there's a lot of opinions, and a lot of things that are not based on science, and a lot of people, not wanting to believe in the doctors and the government, and the conspiracy theories. But you have to ask yourself the question: how many people do you know that have died from the vaccine versus how many people do you know that have died from COVID without the vaccine? So, with the vaccine, you have a higher chance of surviving and reducing the risk of hospitalization. And it has been researched and found out that vaccinations prevent hospital stays. A lot of people don't consider that whenever they look at things, and they don't think they're going to be the one in the hospital. Oh, well, yeah, hey, I'm young and, I'm full of energy and I don't have all those comorbidities. So if I get the virus, then hey, I won't get sick and I won't be hospitalized. But the problem runs into play is, hey, when you get the virus and you spread it, you then can give it to somebody who is immunocompromised, and that immunocompromised means that you don't have the ability to fight off germs like other patients. But the problem that people don't really think about is, what if the hospital is full with COVID patients, and it's your mother or father who doesn't have those illnesses, that has to have emergency surgery.
Mm.
And we don't have
Very
room
good.
for them.
Yeah.
And we have to put them off needing a urgent surgery or emergency surgery because the hospital's full.
Mm-hmm.
And it can come down to that where we have to stop elective surgeries. So, your knee pains and your hip replacements that can lead your parents or your loved one to become immunocompromised in that situation. And then they're in the bucket of the high-risk COVID patients.
Yeah. We were talking earlier about those that have been admitted to the hospital, maybe just in today, but those that are admitted to the hospital doesn't necessarily mean that the ICU unit is full, or do you have capacity right now in the ICU unit with this COVID or what?
Currently, right now, and literally I just left, we're at capacity. We're at capacity. Out of the patients that we have back there, 6 are COVID patients, and then the other 6 are non-COVID patients.
Mm-hmm.
And then the other units that I am over, my telemetry unit, which manages the heart floor, there are 10 COVID patients as well as 5 regular patients. And these are patients who admit to the hospital with chest pain and those normal common things that you saw before COVID that are still going on with people.
Yeah.
And then that leads to problems. We are in a community where high blood pressure, diabetes, and a lot of those comorbidities exist because people don't take the medications appropriately. So you have that compounded on top of COVID, then that's what creates the backflow in the ER.
Yeah.
A lot of people don't think that affects them. Well, hey, if I cut my finger in the middle of the night and I'm bleeding, but it's not a serious injury, I have to go to the ER to get my finger stitched.
Right.
So what happens? I have to wait 3 and 4 hours. A lot of people say, well, hey, I don't want to wait 3 or 4 hours.
Mm-hmm.
I'm just going to go home. So what do? I put a bandage over that finger, and then from there,
Mm-hmm.
2 days later, it gets infected.
Mm-hmm.
Now you have to come back to the hospital. So it is a snowball effect that we're dealing with here, and not everybody is thinking in a manner of their fellow human.
Yeah.
And we have to get back to the point where we think about each other and care about each other versus ourselves.
Mm-hmm. I've heard this term, over this past few months, or the Delta and the variant. Could you just elaborate on that a little bit for me? What is the difference between the two? Are there any difference, or is that just another term for COVID-19?
So it is a variant, but it's like flavors of ice cream. Ice cream is ice cream, right? And I make that simple analogy as viruses jump from person to person.
Mm-hmm.
It then mutates.
Yeah.
Viruses are really, really tricky organisms, and over the years there are no cure for viruses, and the reason why is because it mutates so easily.
Yeah.
So as more we pass it along, the more it's going to mutate. Mm-hmm. So that's why we really push the vaccination, because the vaccination can halt that mutating effect, and it can make our vaccination effective versus ineffective.
Yeah.
So the more the virus mutates, the less ineffective the vaccine is.
Okay.
So, and I'll give you a small example. Over the years, people speak about the flu shot. Well, hey, I still get the flu. Well, I was a firm believer at first, that, hey, I'm going to get my flu shot. Well, one year I missed my flu shot, and I caught the flu. I normally catch the flu every year except this particular year, and I guess that's a relation to mask and, hand washing and things along that line that can protect us. But that one particular year that I didn't get the vaccine, I was in the bed for 5 to 6 days. Yeah. Where normally I can move around and I'll have the sniffles. Well, that particular year I had a terrible, terrible bout with the flu.
Mm-hmm. We have talked a lot about the adults contracting this disease or this the COVID. Very rarely have we talked about children contracting this disease. Now, no, you said that the ICU is probably at its capacity, and we're getting adults, I'm assuming, in, and we're building up, it's gaining. But what about children? Have you seen the increase or any kind of flow of children that may have contracted?
Well, the thing with children are less likely to practice the standard precautions that we have, and that's
Mm-hmm.
hand washing. And it's just because they're young. They're young and they don't think about stuff like that. And I literally was having a conversation with one of my loved ones the other day. We were all jumping on the trampoline with my children, and I said, back in the day, I had no fear. I jumped, and I do backwards flips, I do frontwards flips, and I just didn't have that basis of fear, and I didn't practice that level of concern or being weary of injury.
Right.
So as we get older, we start to realize, well, I better not do that. I have to go to work the next morning. Or I don't want to be injured because I understand the consequences of injury, whereas children don't understand that and they don't practice the same hand hygiene, not touching your face, those things that children don't think about. So with that being said, since we have gone away from wearing the mask, and we've gotten a little bit more lax with hand washing, and I went to Lowe's just the other day, and not to say anything bad about Lowe's, but I noticed that they didn't have as many hand washing things at the desk as that they had before. So as we go away from those precautions, children tend to spread it more. Now, as far as admissions to the hospital, we haven't seen any admissions yet from the adolescent group and the younger children, but from statistics and numbers that are reported, we see that kids are contracting it more, and I think it's just based off of the drop in use of standard precautions.
That was going to be my next question, because I've read and I've heard we're in several places that it looks like the adolescents are the targets for this, and I don't know if, I'm sure that the variant or that the disease is not saying, okay, that's a child I'm gonna jump on, but some way that it seems like that the children are the target for this disease now, but I don't know of any way of combating that.
Well, the thing is we have to remind parents to keep their children safe. And if you're not vaccinated, and there is no current vaccine for children right now, and it hasn't been studied, so they haven't given it to them yet. But when it becomes available, I encourage vaccines for children. But I think our best combat is to continue those standard precautions, continue to socially distance, continue to wear your mask if you are not vaccinated. And I'm definitely not saying that we need to mandate the vaccine worldwide or anything like that along those lines, but people have choices, and we hope that people make the right choice and try to work together to beat this virus and decrease the symptoms of this virus so we can continue back to normal life. Yes, it is a sacrifice, but to parents, please, take in mind and consider that whenever you're making choices for your children, because we don't want, immunocompromised children to have to come to the hospital.
Right.
But like I said, with the virus mutating, we don't know what it's going to mutate to. But we hope that it mutates. If it does mutate, it becomes less.
We had talked about, and I think, Deborah, you can help me on this, but we had talked about Ike Perkins. I've received both shots. With everything new seem like on the rise now, would it be necessary for me to pursue or to get a booster shot? Or is that what the booster, maybe I'm asking, what is the booster shot? I may need something else to help me with this, but would that be considered a booster shot?
So right now, researchers are determining what the booster should look like and how it should work. Every year we get the flu shot. So, scientists work diligently on what medications that we can give to combat viruses. Like I said, right now there's nothing on the market just yet. So I think, what we need to do is continue to practice safe distance and continue to push the vaccine to the people who are not vaccinated. And that way we can try to decrease where we are now. But, continue to wear your mask and wait for science to tell us, hey, this is the booster, this is effective. They are currently working on one, but we don't know exactly what the determination is going to be just because this virus is mutating so quickly.
You just made a good point of waiting on the science, listening to the scientists. And I think this was the main purpose, I know, for this program, is to have those that are in the medical field that will lead us medically as to the way that we should go, wearing the mask or getting the booster shots, and I think that you guys are doing a great job of informing us or educating us on what to do with this virus. So, is there anything else that we are not doing. We are wearing the mask, and I know a lot of people are reluctant to get the shot. So what else can you share with us that we need to do to fight off or to win this war on this?
The major thing is to communicate
Yeah.
effectively. The standard precautions. Continue to wear your mask. It starts with you. It starts with me,
Mhm.
right? If I make the conscious decision to protect myself and protect my community, then you're more compelled to care about your fellow human,
Right.
and you tend to understand that, hey, I may be young, I may be strong, I may be energetic, but at the same time, I know that I can shed the virus, if I'm not vaccinated or vaccinated, to somebody who's immunocompromised.
Mhm.
So it is really, really important to just practice those things and communicate with your family. Encourage your family to get vaccinated. Encourage your family to wear your mask. Encourage your family to wash their hands continually.
Mhm.
So if it starts with you and you doing those things, people can follow you.
Right. Yeah. I know there's been a lot of discussion, and maybe this may not be for you to answer, but we'll soon be going back to school. And a lot of this has happened over the summer. Uh, like you said, the mutation, and it can easily happen. And with our children going back to school, and I don't know who is going to be responsible for mandating masks in school, but how would the hospital and the Dr. Lowry's and the Dr. McClintons and the Jarrell Suddreth lead us into that way?
So from a hospital perspective, we don't control the school's policies,
Right.
but what we do is we can give recommendations based off of our education level.
Yeah.
And definitely, I believe that in my recommendation is to practice standard precautions. Here at the hospital, we wear our masks 24/7 unless we're in a room alone. So I believe that with children, and I'm a firm believer as this year that went by, I normally contract the flu, and I normally contract it from my kids.
Yeah.
This year, my kids were not sick ever. Not one time were they sick.
Yeah.
So that
Yeah.
says something to the science and the teachers that, hey, we had less sickness going around in the schools, but we kept it clean. We washed our masks. We socially distanced. So that did work.
Yeah.
And I think that that needs to be taken into considerations when the school makes their decisions.
Mm-hmm.
Definitely we are a hospital that is about our community.
Yeah.
And the school officials, if they listen to this, definitely reach out to us. Definitely take our recommendations. We will definitely give you the best recommendations of what we're practicing.
Yeah.
But like I said, we can't enforce that rule on the school
Right,
system. Yeah. But from a personal standpoint, I know it right now it is optional, but my children will be wearing masks.
Yeah.
Because we believe that is going to help the community versus hurt the community.
Mm-hmm. Well, Jerrell, bad as I hate to say this, and I hate to look at Douglas and take my cues from it's time to cut or it's time to pull it in. I have a senior pastor here, and you may know Reverend Norwood. Rev is an elderly pastor, and then when I get to preaching too long, Rev will start saying, all right, it's time to bring it in. It's time to bring it in. And I know right then what he's talking about. But I'm going to continue these discussions with the hospital and as many as personnel or doctors that we can muster up to come and be present on this program. I've gotten a lot of feedback. I was at a place yesterday, and the lady come up and shared with me how much she appreciated and enjoyed the programs that we're having, particularly when we had Dr. McClinton and Dr. Lowry on last week. She said, well, you need to have more. I said, well, I'm trying to get every ounce I can from the hospital, and you have just added to what we've been trying to do here. And I thank you so much for your time and for your knowledge and for your wisdom about what we're doing. And hopefully that everybody will join us every Thursday at 7 o'clock, Mount Pilgrim Lenore, NC. So, and come back and listen. And Mr. Suddreth, I want you to know that you're welcome, and hoping that we can leave this dialogue open and maybe we can invite you back again and
Anytime.
share with us some more. So I'm pulling everybody from Caldwell Memorial. I don't want, at the end of the year, I don't want anybody there that can say, well, I didn't go, it wasn't my turn. But I think the more information that we get out, the better off we're gonna be. So again, thank you so very much.
Thank you so much
for your time. And again, just join us every Thursday at 7 o'clock, Mount Pilgrim, Lenore, NC. Have a blessed day and pray for us.
What an informative and educational segment. Reverend Perkins and the Mount Pilgrim Media Ministry want to thank you for tuning in. We are located at 539 Willow Street in Lenoir, North Carolina. Please visit. We would love to see you. Join us every Thursday, right here at 7 p.m. with another segment of Let's Talk to the Doctor. Be blessed, and we look forward to seeing you next week. We would like to thank our partners, Caldwell UNC Health Care, as we are doing good in the neighborhood. Please hit your share button at this time.